So what are the treatments that we use for myeloma? And as I said, fortunately now we have many agents that are effective against myeloma. And commonly we use 2 or more drugs in combination. The exact choice of drug depends on a variety of things, which I'll come to again in a second. And drugs like lenalidomide, which is also called Revlimid, or a drug called thalidomide, bortezomib or Velcade, dexamethasone, and some other newer drugs that have been recently approved are commonly used for myeloma. The exact choice of drug for a particular patient depends on a number of things, including the risk category of myeloma, the general health of the patient, the kidney function, the physician's experience with certain drugs, and to some extent their choice. And we take into account always the patient's personal choice and what are their life goals before deciding a specific treatment plan for a particular patient. And certainly the treatment has to be tailored to the individual. And one size does not fit all. So there is not one standard treatment for myeloma that is applicable to everybody. In terms of treatment, I also want to highlight a very important role that stem cell transplant plays in the treatment of myeloma. And just for clarification, here we are talking about transplant from a patient's own stem cells, something we call autologous transplant. We are not talking of transplant which is done from a donor, although we sometimes use those transplants for some patients of myeloma in certain specific situations. Most myeloma patients who are otherwise in good health are candidates for transplant and should have their stem cells collected and preserved within a few months of beginning the myeloma treatment. Now, after the stem cells are collected, in some patients, transplant can be safely delayed, but in others, particularly patients with high-risk disease, transplant is strongly recommended early in the treatment process, generally within 4 to 6 months of starting myeloma therapy.